I want you to ask yourself a very important question. When's the last time I got a massage? If your answer to that question was too long ago or never, you're definitely missing out. According to the International Journal of Neuroscience, getting massages regularly helps reduce low back pain, lowers stress, and increases range of motion. Having personally been a licensed massage therapist for the past 3 years, the two main questions I get asked are, how often should I get a massage, and how do I give someone else a massage? The most important steps for giving an effective massage are utilizing the right equipment, conducting a consultation with your client, and performing proper massage techniques. As I already mentioned, utilizing the right equipment is essential for delivering an effective massage. You're going to need to start off by graduating from an accredited massage school. Then you're going to have to obtain your licensing information and always stay up to date with your state's personal licensing laws. Then you're going to need a massage table. You're going to need sheets and a blanket, and be sure to use a pillow or a bolster to put underneath your client's knees to help limit some of that pressure that's going to be on their low back. Be sure to pick out a good massage grade lotion or oil to use during your massage. Always have relaxing music because it helps add to your massage, and then have a client. After you have all of your equipment, especially your client, you're going to have to perform a consultation. Consultations are based off of your SOAP note structure. SOAP note stands for Subjective, Objective, Assessment, and Plan. During this subjective, you need to ask the client what's going on with them. So you're going to ask them along the lines of what's hurting or what they want you to focus on. Also be sure to ask for their medical history. This will point out any contraindications you might have for their massage. Contraindications are things like unmaintained diabetes, unmaintained hypertension, varicose veins, or even local contraindications like cuts or bruises. Always be sure to ask your client, have you had a massage before?
No.
This question is going to give you the answer to what kind of pressure they're probably going to need. People who haven't gotten very many massages are typically going to start off with light pressure because it's easy to get sore after your first massage. Before you step out of the room, be sure to inform your client that they need to undress down to their comfort level. Then you're going to have your client either lay face up or face down, just depending on your client's specific needs. During this time, while the client is taking a couple minutes to get onto the table, it's always good to start filling out the subjective part of your notes. The objective assessment and plan will be filled out after you're done with the massage. Especially the plan is what you're going to tell the patient or your client what they're going to have to do after the massage. Just give the door a little knock, and you can go ahead and head in. Now that your consultation is complete, you can go ahead and begin your massage. To begin with, always start with the palms of both of your hands and just go down the back all the way to the top of the hip bones and just put a little traction on it. Doing all of this is going to help you feel where the client is really tense, and you might be able to hear them tell you where they're starting to hurt. I always start with the back because this is the area that I spend the most time on during the massage. Be sure to tuck the sheet into the client's undergarments to help keep the sheet secure and to help your client feel comfortable. Your next step is going to be go ahead and apply the lotion. Go ahead and rub your hands together to help warm it up just a little bit. Start off with some light effleurage strokes. This light effleurage is going to help loosen up all these tight muscles, all the superficial ones. Getting rid of that initial tension will help you get to deeper layers of muscles, and it'll also help your client not be so sore afterwards. Work from broad to specific. This means that you are going to be working on bigger areas first, bigger muscles, and then work your way down. A more specific thing I would do is look for an individual knot and apply a smaller area, such as the tip of my elbow, rather than the palm of my hand, and apply a lot more pressure. This is going to help me get this one area out better than if I were to use my palm. Once you've finished massaging an area, be sure to replace the blanket, as it keeps your client warm and helps them feel secure. After you're done with the back, move on to extremities. Again, only have this one extremity undraped during the massage to help your client stay warm. Don't forget to apply more lotion. When possible, always work in centripetal motion. Centripetal motion means towards the heart. This is going to allow for the normal blood flow of the body. After you're done working on the area, be sure to replace the blanket. After you're done working on all the extremities, you're going to have your client flip to the opposite side that you had them start on. Go ahead and flip over onto your back for me. Just lift up the blanket and make sure they don't fall off the table. How are you feeling?
Good.
Go ahead and lift up your head and relax. Now I'm going to be working on the neck. How many areas of the body you work on during the massage is going to dictate how long the massage is. During a 60-minute massage, that is a typical full body massage. During so you will work on the back, arms, legs, neck, scalp, and feet. Make sure to periodically check in with your client to make sure that you're not giving them too much pressure. How's that pressure?
Feels great.
Move on to the next extremity. Go ahead and stick your arm up. It's always important to have proper body mechanics while you're massaging. You never want to bend in an awkward position because it will cause you to have low back pain. And again, put the extremity back under the blanket. It's always important to massage the same number of extremities during the massage so that your client feels balanced. How is this pressure?
Feels good.
Again, replace the blanket. I personally like to end with the feet. This is because it's a good ending, and most clients prefer that you don't touch their feet and then touch other parts of their body, such as their face. After you're done massaging the feet, put the blanket back over them. Wipe off any excess lotion or oil so they don't slide when they get up. Be sure to instruct your client to drink plenty of water to flush out any toxins released during the massage, and ice as needed if they think they're going to be sore. In summary, helping clients with the therapeutic benefits of massage is a rewarding experience. Performing effective massage requires utilizing the proper equipment, conducting a consultation with your client, and performing proper massage techniques. Even though helping clients can be very gratifying, don't forget to physically take care of yourself by getting monthly massages.